3-minute summaries. Think you might be interested in becoming a registered nurse? Here are some steps on how to get started and a little about the career. First of all, what is a registered nurse? According to experts, a nurse is a healthcare professional who focuses on individuals, families, and communities to help them attain health and quality of life. You might see a registered nurse at a hospital, a doctor's office, a long-term care facility, in the community, or at your school. To be a great registered nurse, you'll need to be good with people. Nurses interact with patients, talking to them about medical conditions, nursing interventions, medications, and their overall health and well-being. Think well on your feet. Nurses are often faced with making split-second life and death decisions. Be good at science. Subjects like anatomy and physiology, microbiology, and chemistry are important to understanding nursing science. First, let's talk about the RN question. RN stands for Registered Nurse, and it's a license nurses receive when they pass the state board examination administered at the end of their education. There are several educational pathways to becoming a registered nurse, but no matter what program you choose, once you pass the state board exam, you will be an RN. Confused yet? Let's clear this up. There are several ways to get your nursing education. Here they are, in order of the time they take to complete. An ADN is an associate's degree in nursing. This is a 2-year program offered through a community college. At the end of the 2 years, you graduate, you take the state board exam, and you're an RN. A diploma program is usually a 2 to 3-year program offered by a hospital. Once you finish your diploma and graduate, you take the state board exam and become an RN. A Bachelor of Science in Nursing is the 4-year degree offered at a college or university. After graduation, as with the other programs, you take the state board exam and become an RN. But wait, you might be wondering, why would anyone choose to go to school for 4 years when 2-year programs are also an option? And that's a good question. Since healthcare gets more complex all the time, in order to advance your career, you will more than likely need the 4-year BSN degree. Many people choose to do their BSN all at once, but even if this isn't an option for you, there are still many ways you can finish your education while you're working as a nurse. So, to sum up, choose your educational path, study hard, graduate from nursing school, pass the state board exam, and become an RN. Simple, right? Then, you're on the job. Nursing is a career that's expected to keep growing as our population ages and as more people have access to healthcare. And there are many fields of specialty you can focus on, like critical care, oncology, maternal and child health, public health, or many other areas that might interest you. Okay, we've told you the different ways to become a registered nurse, but we don't want you to feel overwhelmed. Here are some steps you can take today to get yourself started on making your goal a reality. Go and talk to a registered nurse. Ask them about their career, how long it took them to complete their education, and what an average day is like. Volunteer in a hospital or long-term care facility. You'll get familiar with being around sick people, learn medical terminology, and see what registered nurses do, and will also look great on your nursing school application. Sign up for a college-level chemistry or biology course. Get an entry-level job in a hospital, long-term care facility, or doctor's office. That way, you can interact with registered nurses and see firsthand what they do. If you like what you see, you're ready to explore nursing schools. Want to learn more? Visit discovernursing.com to get more information and to start your search for programs and scholarships. 3-minute summaries.